because Health Secretary Sajid Javid is apparently waging war against gender-neutral language in health advice. The Sun reports today that he's ordered NHS bosses to call women women after it was revealed the word was dropped from websites about ovarian and womb cancers that sound that revolutionary. Apparently it's been replaced with phrases like anyone with ovaries. A source close to the Health Secretary says he's worried that confusing language could harm patients, so he's told the Health Service that any future changes must be run past senior officials first. The NHS claims it's trying to be inclusive, respectful and relevant. But surely if you want to be relevant to women, and even to people who are still women biologically but identify in some other form, they've got ovaries, they're at risk of ovarian cancer. You're only at risk of ovarian cancer if you're a woman biologically. Why would you take the word out? Because, I mean, even if you want to explain that we understand there might be other genders that have moved on from being a woman, you were still a woman to have the ovaries in the first place, weren't you?
I can see how the NHS has got its knickers in such a twist about this and got itself in such a model, because it starts off thinking, ooh, we need to change the way we think about ovarian cancer or prostate cancer or whatever it is, because we now understand there are people who started off as a woman and now identify as a man and vice versa. So they're trying to be inclusive and trying to get with the get with modern times. But then, of course, have gone too far because and often it's because they have had focus groups or they've had agencies who've come in from Stonewall or wherever it is and said, you know, what you're doing isn't nearly enough, rip that up and take that word out. And they kind of go, oh, OK, you know much more about it than we do.
There's a really easy solution. Why don't they put women or those with ovaries or people with ovaries or whatever? Or, and then the same with men. Men or those with prostates.
Because it's
or
ridiculous. Because it doesn't make any sense. I mean, there's a very small
number
of people...
You could be taking drugs to make yourself into a...
You could.
So
but you would still understand that you had ovaries once and that you might be in danger of getting ovarian cancer. One of the criticisms of this was that people were saying that if you're not particularly familiar with English, if you're reading English as a second language, if you're not particularly well educated,
literacy,
you might
dyslexia,
think it doesn't actually apply to you.
But that's what I'm saying, women, or
because it doesn't say women.
Well, if you say women first and then in brackets, that's what I'm saying.
I think that's
women
really,
or those with ovaries, and then men or those with prostate.
But that's how you get
putting in brackets.
I think that is the way forward, and I absolutely agree with what Daisy said. I think this was done out of good intention, but I think lots of NHS organisations, and not just NHS organisations, a lot of organisations have got worried about risking the ire of a certain section of activists.
And if you do get their ire, it's scary.
It's absolutely, it's really scary. They're very scared about a backlash. But it's like all common sense and courage has flown out the window. And actually, most of the transgender people I speak to have got no problem at all with, let's say, what you have suggested. It's often the kind of extremists on both ends of the spectrum that really sort of kick off. I just think, so I actually do support Sajid Javid in this, but I think Penny has a sort of better, more future-proofing solution. Whether we like it or not, Penny for Health Secretary, basically.
Yes.
Penny for Health Secretary.
Should it not become the thin end of the wedge, though? Because that's how we went from having 2 genders to 3 or 4 to 100. And now we've got 100 genders, and you'll be sending out pamphlets about this thick to take care of everybody.
I think that ship has I think things are changing. I think there's a generation below us who just, and whether we can get our head, whether we can get our head around it, I think things are changing with a different generation. But I do agree, the idea that we eradicate the word woman is a nonsense.
Yes, and that's exactly right. But I've seen it on, you know, with men's prostate conversations as well. I've seen doctors on the BBC convinced that they should talk about people with prostates. And again, it's the same problem. You know, most people with prostates are men. All of them were men at one point or another. And the number who are no longer men are so minuscule as to not be necessarily included in that particular conversation, surely.
But one of the things I think is encouraging, we've all had our own discussions about the trans debate, and the agreement is it's very toxic. It's a really, really nasty debate to get involved in. But there's a really interesting piece of research this week out saying actually where the public is in a much more moderate, nuanced place where most people do want to be kind and supportive to people transitioning. We do recognise that change is happening, but they don't want the word woman to be eradicated or they do think there are issues for debate, like single-sex spaces and women in sport, for example. So I think there is a common sense, compassionate, humane way through this.
Yeah,
I hope
and
so.
you don't have to be 100% in one camp or 100% in the other camp. You can.
It's not a binary thing.
It's not a binary thing, to coin a phrase.
Non-binary thing.
We
Is
can
there a
identify.
non-binary thing? Can you have that? It's a non-binary thing.